All right, let's dive into something really important today. We're talking about the moral compass that guides one of the most vital jobs out there, nursing ethics. It's this, silent but super powerful code that makes sure compassion is always front and center in patient care. So how do you even begin to build an ethical framework for a job as complex as nursing? Well, it all starts with one number, 9. That's it. Just 9 core provisions, and these form the absolute foundation for every single decision a nurse has to make. Okay, so who's in charge of this incredibly important code? That would be the American Nurses Association, or the ANA for short. You can think of them as the guardians of these values, making sure the code stays relevant and central to nursing today. So what is the ANA Code of Ethics exactly? Well, it's the foundational, non-negotiable ethical standard for every nurse out there. And I want you to think of it less like a list of suggestions and more like the absolute bedrock of the entire profession's integrity. And here's the thing. This code isn't some dusty old book sitting on a shelf. Nope, it's a living, breathing framework. It actually got a major update back in 2015, and the goal wasn't to change the core principles, but to make sure they could handle the challenges of modern healthcare. We're talking about everything from new tech and social media to the way we think about patient rights. Okay, let's get to the first provision, because this one really grounds us in the why of nursing. It's all about one simple, powerful idea: respect. This is the cornerstone of every single ethical decision that comes after. The code itself couldn't be more clear. It says a nurse's duty is to provide respect and compassion for every person regardless of any individual characteristic. I mean, it's a pretty simple sentence, right? But the implications, they are absolutely profound. So that really makes you wonder, doesn't it? In the world we live in today, which is getting more and more complex, why is this one single rule so critical? Why does it matter now more than ever? Well, it's because nurses are working in this incredibly diverse, multicultural world. Every single day, they have to navigate completely different, sometimes conflicting views on what's right. So this principle of universal respect, it becomes their anchor. It's what lets them build that crucial bridge of trust between their worldview and their patients. But here's where it gets really interesting. The code doesn't just stop at having nice values. It actually transforms those values into duties. And that brings us to our next big idea from the ANA code, the very real weight of accountability. Now, accountability isn't just one big, vague thing. It actually stands on 3 distinct pillars. First, nurses are accountable for their patients' health and well-being. Second, for the integrity of the entire profession. And third, for their own personal integrity and conduct. It's a big responsibility. So this whole idea of accountability means nurses have to get really good at spotting when an ethical issue is actually happening. But then what? What do they do? That brings us to the very first step in making accountability real, moving from just seeing something to saying something. Okay, so you have to respond. That's one thing. But what's that crucial first step? The one that takes you from intending to do something to actually taking meaningful action? And this is where we find the single biggest roadblock. It turns out the problem usually isn't that people don't want to do the right thing. It's that we fail to recognize the situation for what it is. We just don't label these tough spots as ethical issues to begin with. But watch what happens when we do label it correctly. It's almost like magic. That simple act of just naming the problem, it unlocks this whole toolkit of skills, frameworks, and new ways of thinking that helps you cut through the confusion. Suddenly, there's a clear path from seeing the situation to finally speaking up. Because at the end of the day, that is the goal, right? Accountability isn't something you just are. It's something you do. It demands action. It's a constant reminder that being accountable means speaking up and speaking out about issues that really threaten the core ethical values of our profession. And that leaves us with a really powerful thought to end on. If this entire code is built to give a voice to ethics and compassion, what's the real cost when that voice goes silent?